Let's call this meeting to order. We'll stand up and do the pledge of allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Morning, everybody. Good morning. Okay, first thing on the thing will be to approve the agenda. Any changes or approvals?
I'd like to add something to the consent agenda.
Okay.
The job classification for Travis Lapham from sheriff's deputy of C41 to patrol sergeant C42, effective on 1/17/22. I just got a call from the sheriff this morning here 5 minutes ago saying he's on his way to a meeting he didn't know he had to go to, so he won't be here, but he's filled me in on everything, so.
This is kind of the final paperwork on Travis for switching from.
Yep, it's just an internal
Promotion, wasn't it?
internal promotion. It was the previous person who had that position went back to his old position, so.
What else do you have? That it?
Result in having to have another hire to replace.
No.
I mean, the one person moved, he's taking his place. Is there somebody taking places in now?
No,
You're just going back to the back position he was in before, the one who's
Yeah,
leaving. is-
right, yeah.
So it's no different staffing, just different areas.
A little different in pay scale too, right?
well, yeah, he's gonna move to patrol sergeant, so it'd be from 41 to 42.
Yeah, a bump.
Anything else we want to add to this?
I make a motion, we approve the agenda with that addition.
So that,
Okay.
Got a motion and a second? On that addition to the consent agenda, all in favor, signify by saying aye.
Aye.
Opposed? Same sign, everybody's good to go. All right. Approve the previous minutes from board meeting January 4th.
Move to approve.
I'll second it.
Well, we got a motion and second. Is there any discussion? All in favor, signify by saying aye.
Aye.
Opposed? Carries. Public comment. Do we have anybody from the public that would like to say something at this time?
I don't see anybody on the screen.
It's flashing or.
Got Matt Schultz.
Yeah, Matt, you got anything you want to add today or no?
this would be EDA probably.
Nope, just listening in.
Appointments, 9:30. Well, we gotta move on, I guess, unless,
We can make me last if other people are here, want to go ahead.
okay, then we'll pass you till 9:30. We'll go to consent agenda, and that would be the Travis Lapham.
Yep.
Move to approve.
So I got,
Then a motion and a second to approve it. Any more discussion? Okay, everybody vote in favor of saying aye.
all right,
Aye. Opposed? Carries. Action. Consider reappointing Bob Carlson to the Bluff Country, Minnesota Multi-County Housing and Redevelop Authority Committee, 5-year term.
Yeah, it was brought to my attention that his term actually expired in August. So I called Bob Carlson asked if he would be interested in re-upping it's a 5-year term, I think, Carol. We determined.
Yes.
So, and he said he would, so I make a motion, we approve Bob Carlson to serve on the the Bluff Country, Minnesota Multi-County Housing and Redevelopment Authority Committee.
Second.
There's been a motion and a second to appoint Bob Carlson to the Minnesota Multi-Housing and Redevelopment Committee. All in favor, any discussion? All in favor, say aye. Aye, opposed, motion carries. Consider adopting $100 from the Brownsville VFW to the Veterans Service Office to use for any veterans needs.
Just a standard thing. I move to accept the donation.
I'll second it.
There's a motion and a second to approve the donation. Any discussion? All in favor, signify by saying aye.
Aye.
Opposed? Motion carries. Number 3, consider the resolution number 22-07 indicating Houston County will participate in the hazardous mitigation assistance grant program, authorizing the emergency manager director Mark Olson to execute and sign such agreements and amendments on behalf of Houston County.
Mark?
Good morning, Commissioners. Looking for approval on this. Every 5 years, the counties across the state go through a update to the hazard mitigation plans. The state funnels some grant money through FEMA. It's a 75% cost share that they would cover, and the 25% that we'd be responsible for is paid by in kind and the work that we do. So there's no actual money out of pocket for this.
I make that a motion to approve resolution number 2207.
I'll second it.
There's been a motion and a second to adopt the resolution number 22-07. Any discussion? All in favor, say aye.
Aye.
Aye. Opposed? Motion carries. Number 4. Consider adopting the test and mass policy. Yes.
Maybe John wants to talk about it.
John, you want to talk on that, or Tess, or who's in charge?
It's Tessa's. Is she here today?
She's sick. She's been sick, you know.
We'll have to table it until she comes. That'd be nice if you could, John.
Good to have the appointment with Allison then while we wait.
Well, we can go back to Allison now if you want.
Might as well.
Everybody okay with that?
Yep.
Sure, all right.
Get her done.
Let's get her done.
She's wanting to speak.
So every year, I like to come before the board and just give our EDA annual review. As I think everyone knows here, Houston County contracts with CEDA 3 days a week to provide economic development services. And so through that role, I get to serve as the Houston County EDA director. Thanks a lot for that. I really enjoy the EDA work that I do. So I'm going to read just a little bit from our annual report. The Houston County EDA began 2021 by continuing to help businesses work through unprecedented challenges caused by the COVID-19 pandemic. A total of $367,594.71 in grant funds was awarded to 107 eligible businesses in 2021. In addition, $1,187,166.36 in grant funds was awarded to 245 eligible businesses back in 2020. And that was all because you as commissioners decided to allocate over half of your CARES Act dollars to businesses, and that was greatly appreciated. Despite the pandemic, Houston County businesses have proved to be resilient, innovative, and adaptive. In addition to providing COVID-19 related funding assistance, the Houston County EDA continued to work on new and existing projects. These projects included securing funding for Houston County's first and only co-working space, helping farmers, working on addressing childcare needs, and the continued expansion of the Bluff Country Collaborative Program, which has grown into a strong partnership with organizational partners, school districts, many area businesses, and that's actually all the school districts in Houston County. So these accomplishments, in addition to the day-to-day work of connecting with businesses and providing assistance to entrepreneurs, have set Houston County up to become a recognized leader in rural development. Thank you for your support and participation in 2021. So I have a few highlights to go over. Under COVID-19, actually the total between 2020 and 2021 that the EDA in Houston County allocated to businesses was $1,554,761.07. So we're really proud of that. And again, like I mentioned before, the businesses were really thankful for that. This year, we also administered 2 EDA loans. They totaled $105,000 to Houston County businesses. The first one was a $30,000 loan to Kristen A. Collins and Vicki Olson for Timeless Creations LLC in Houston. They are expecting to have a grand opening anytime now, so more details on that to come, but this project retained the workout center, which was already there. And then they're also bringing in a business with home decor called Timeless Creations. We also administered a $75,000 loan to Ascentech, and this was for matching funding for a broadband expansion grant. This was a great project that brought broadband to businesses, homes, and students in the county. We currently have 13 active EDA low interest EDA revolving loan funds. We do have a lot of money available to lend businesses. We typically do up to $30,000 and it's gap financing. Sometimes we do more in special occasions like we did with Ascentech. So definitely spread the word to any starting or expanding businesses that you think could use that funds. Moving on to the Bluff Country Collaborative. So we continued working on this and we now have a BCC Career Navigator. Southeast Service Cooperative, who's one of our partners, is actually the fiscal agent for our Career Navigator, and her name is Marianne Smith. She's been a huge help. We also partner with some other organizations on this, like CETA, Perkins, and Workforce Development Incorporated. One of our accomplishments this year was the CTE Career Fair. We did it outdoors in Caledonia. We made it work. It did not turn out to be a super spreader event. We were very careful with COVID. Again, it was outside and we had about 600 students attend it and about 30 businesses. It was a great event. We also started an ambassador mentorship program for students, and the goal of the program is to increase participation in career and technical CTE programs. So we actually partner students up with professionals, and they've been doing Zoom meetings quarterly with their professional. So they can ask them whatever questions they want, really get to know them, get to know their story. And we have especially been focusing on mentors for students from historically marginalized groups. So this has been a really great program for students that maybe wouldn't have connections in fields that they're interested in otherwise. With the help of our new BCC Career Navigator, Marianne Smith, who I mentioned before, we've set up student internships. And then also we've done a lot of job shadows, and this report actually says that 60 students from Houston and Fillmore County have done job shadows, which I did not update. This is actually over 100. So we're really proud of that. I've heard from both parents and students and mentors that it's going really well. So we pair a student, or I call them mentors, but whoever their job shadow, we pair a student up with the job shadow. We let the student know if they're going to be outside, what kind of clothing they need to wear, if they need to wear boots, safety gear, that kind of thing. And then they actually are on the job, usually for the whole school day. So that's been a really good program. Keep Company co-working space, more on this to come. The grand opening hopefully will be soon. We're running slightly behind schedule like everything is these days. But we are hoping that soon the co-working space will be open in La Crescent. The purpose of this is that oftentimes it can be hard for startups and small businesses to afford working space and justify expenses on things like technical support. And additionally, many of our small businesses have a limited need for full-time offices, but would instead benefit from a common space in which to meet existing and prospective clients. So to add value to this project, we'll also be contracting with Houston County businesses who will offer their services on set days out of the space. So more on that to come, but that will be opening. We have our farming initiative that we've been working on for several years now. And just a reminder on that the EDA's goal is to get to know farmers, develop plans based on their individual interests and needs, and then help them adapt so they can be successful. And then the last page is just some 22 goals that we have in place. But again, thank you. And does anybody have any comments or questions?
Do you work with workforce development on some of these mentoring programs? Because I know
We
they're
do.
big on that.
We do. So workforce development, it's all through the BCC, and they are a partner in the BCC. And actually,
Okay.
one really great thing that workforce development can offer is if a student needs something for a job shadow, for example, and they maybe don't have the resources to purchase the boots that they need or the safety gear, WDI has helped out with that. So yes, we do work with them. And they're a great partner.
I have a meeting with them on Thursday, so
Yeah.
join power, so good. I've been very impressed with their work too.
Yeah,
They
they're
do the
great.
same thing.
They're a great partner. And one upcoming thing we have tentatively scheduled for March 9th, a BCC career fair in La Crescent at the La Crescent Area Event Center with both schools and businesses. So all partners will be involved, but WDI will be specifically working with me on that. So
Sounds good.
So like farmers, do you give them like crop expense loans or what do you do for farmers? Or what parts of farming do you get involved in?
yep, so it really just depends. We have our low interest revolving loan fund, which farmers are eligible to apply to that. And then we look at it on a case by case basis, just like anyone else would be. But we've done some different things over the years. We got a grant from Smith a few years back to offer farmers some training and some other things. We've helped farmers find a job off the farm if they need a job off the farm. We were able to use grant funds to purchase some books and some other resources that we can loan out to farmers. For example, if they're trying to decide if they want to become an LLC or if they have questions about maybe a partnership. So we really look at it on a case by case basis, and we try to do whatever we can to help strengthen their business so that they can stay in the county. Yeah,
Does Winona County do the same? Or don't you know?
I don't know.
Okay.
Well, and one lady asked me if there would be any help through the EDA. They want to purchase a house and turn it into a daycare and eventually live in it after a few years till they get it going. Is there any kind of help for that lady to purchase that house and turn it into a daycare?
Yeah, have them reach out to me.
Okay.
I don't know specifically on the purchase, but we do have resources to help people get started in childcare. Smith is another partner that we rely heavily on. Jeff Andrews is kind of an expert at Smith when it comes to childcare, and he's helped some other startups in our area. And Smith also has some other resources like some loan programs that childcare providers are eligible for. So definitely have them connect with me, and I can see what I could do to help.
Good deal. Thank you.
Yep.
Any more questions for Allison?
Well, you do a good job, Allison, as far as getting EDA organized and getting out there and helping people. So
Nothing but good comments. Keep it up. Thank you.
Keep up the good work.
and you're a good clerk of board. So, thank you.
All right. Now we'll go to number 4, Tess.
Good morning, commissioners.
Nora?
So John
Puglisa and I took your comments under advisory and reviewed the draft policy we had and put in place what we understood were the, was the direction that the board wanted us to consider going. And that was sent to you and in the packet of information. I do believe that there will be some challenges. However, our obligation to OSHA is to act as a reasonable employer and make good faith efforts to comply to our best of our ability. And that includes enforcement of our own policy. So it will be a interesting time in that there will be, I'm sure, plenty of questions that we, John's Department of Public Health and myself will have to address. And we will do so in the most open manner possible with data privacy of any kind of medical information, all efforts made to comply with the Minnesota and federal statutes on that. So with that, I know public health has reviewed potential options for testing. And has a couple of ideas on that. You want to share that, John?
I forwarded those, some summary information to you as a board. I think currently testing is very difficult to obtain. We looked into local healthcare providers and other potential partners that we could potentially contract with, and there's just no takers there. Supposedly there are places that you can buy tests, but what I've seen is you buy them in bulk and you still need to come up with some way to proctor those tests. I haven't explored actually trying to purchase some of those, other than we did purchase for Public Health and Human Services a small number of tests some weeks ago to work with primarily our child protection operation. If we have a child who's in our care, custody, and control, we may need to do a rapid test to be able to, ensure their safety and the safety of our staff. Other than that, we have not purchased tests. I think what we're seeing with testing as a whole right now is just a huge capacity issue. Omicron virus or Omicron variant of the virus has hospitals full, and so your large healthcare providers are more than buried just with people who are symptomatic and sick. And so, it's pretty telling when places like the Mayo Clinic are not tooling up to do asymptomatic regular testing to meet the OSHA guidance. I think it's also telling that some of our county counterparts in the region, including a large county like Olmsted, doesn't have their public health doing this. I know I've said in the past, we don't have the capacity to pull that off. If we did, we'd have done it long ago, because especially before we had a vaccine. But the logistics of putting together a testing process is pretty daunting.
Did you try Gunderson Clinic in Spring Grove? They are testing right
We
now.
contacted Gunderson and Mayo, not specifically Spring Grove. We contacted, Gunderson.
Spring Grove's looking for more. They got it all set up. Drive up test. You pull up, they test you. You got to call ahead to Spring Grove, tell the nurse you got a cough or whatever.
For symptomatic testing, they do have that in place,
We have
which is
both.
good.
They do both, I guess. That's what I was told that day.
We contacted both Gunderson and Mayo. They said that they are not doing asymptomatic regular testing for the OSHA ETS guidance.
Well, I don't know what they're doing, but they're doing some kind of testing over there. So you should maybe talk to them. They want to partner up with us and see if we can't get more people tested. But I don't know how that clinic can be different from that one. I don't know how they operate or who makes the calls. That part I don't know. But this lady,
I will look into that, but we didn't contact specific clinics like the the Gunderson Clinic in Houston or whatever, we contacted Gunderson as an organization and also Mayo. So.
Well, I agree the communications is terrible because I was supposed to, I was supposed to be contacted by Houston County Public Health and I was done quarantined and it was 4 days after that. So, the communication between Wisconsin and Minnesota is not clicking the way it should.
That's always been an issue.
Yeah,
That's not the public health's fault.
No,
There
no.
is just the lag of communication.
Yeah, it has nothing to do with them. If it took them 10 days to call them and tell them that somebody in the county had COVID, then that's their problem, And I guess I got one question is, if you're working as in the Houston County Courthouse, you get COVID, is it a 5-day quarantine or 10?
The new CDC guidelines, I believe, is 5 days after. However, you have to be symptom-free.
Yeah, I think that
I
to make
believe,
a
but I have
blanket
to.
statement is difficult because different, you gotta
Scenarios.
take it case by case. But CDC did change their guidance from more of a 10-day quarantine to 5 days. And we have not seen through all of the pandemic that the Minnesota Department of Health has deviated from CDC, but there is generally time between when CDC makes a change to their guidance as to when MDH catches up, because they have data points all over the place that they have to update. So I've been in contact with Tessa's office and recommended that when in doubt, if there's a difference between the two, it's typically because CDC just made a change, and my recommendation would be to follow CDC.
So in this policy, so that there isn't confusion, because there's going to be plenty of questions anyway that we have to respond to. And we just put following CDC guidelines because of the potential lag period. The other thing, to answer your question on how long a person has to stay out, it depends upon factors, whether there's ongoing exposures, others in their house that are not, that may be ill. And so we address that with each employee individually, and that's how we have been doing that, so that we can, in consultation with public health, so that we are given the best advice we can. So it's not just I agree with John, you can't just make a blanket statement when you don't know all the facts. Do you want to talk about potential fault?
From my perspective, the best option for testing is Vault Health. That is paid for by the state of Minnesota. It's a free at-home test that's proctored. I've done it a couple of times. Essentially, it's a saliva test that comes to you. I think mine came to me via FedEx or UPS. And then you go online and they walk you right through the process. You put it back in and send it back through UPS or FedEx.
It's observed directly,
Correct.
but virtually.
Right. So you go online and there's a person who proctors it with you. That is a free option to people in the state of Minnesota. It, like any other test right now, is in short supply. So you may go there and want one from Vault, and you may get a message that says they've reached their capacity for today. I think we're going to see this evolve not too dissimilar from how we saw the vaccine capacity grow over time. We were tooling up, and it was very difficult to get vaccines this time last year. And as suppliers and supply chains and the machinery of this get put together, I think it will ease, but right now it's very difficult. But I think Vault is a great option for employees to consider. It doesn't require a cost, and it won't require a cost to the county as well.
I think with this policy that's in front of you, proposed policy for your consideration, I encourage you to consider adopting it today. We have a lot of work ahead of us, not even considering the testing, but there's other components of this policy that we need to be looking at. And one is to make good faith efforts to collect the information on our employees who are vaccinated. And that will help, I think, as well, so we know what kind of need we may have with regards to testing. I understand this policy from the federal level and the state level could change anytime, but this is where we're at right now. And so it may not be, we may not have perfect results, but I think it's important for us to have a strong good faith effort to do what is reasonably within our control to comply with this requirement.
Just the fact that we're talking about this and have a draft in front of us to consider, wouldn't that be considered good faith policy?
Well, the supposed deadline for enforcement was yesterday. So the fact that we have been talking about it, yes, but I believe from what I have read so far that we need to actually start taking some action. They're just, for those who've made good faith efforts up to January 10th, the way I understood it, there wouldn't be enforcement sanctions, but going forward, we need to start collecting that data. And we really, my office would not be doing that without having a policy for the employees to follow.
I'm a little reluctant to vote on this today, just for the simple fact the Supreme Court hasn't made a determination on this yet. From what I understand, February 9th is the deadline for testing. For the, yep. So we have a little time here.
For testing, but not for good faith compliance for collecting your vaccination, vaccinated.
Well, other counties in the area are also waiting, from what I gathered from calling around. So, and I've been calling around for tests with Walgreens. I mean, if you went to Virginia, you can get tests, but there's no tests available anywhere. So I don't think the OSHA is going to hammer us for not enacting this today. They'd have to do a lot of hammering. So, and I'm a little leery on the Houston County will reimburse the employee for actual costs, including reasonable fees associated with administering the tests set forth in this policy. I know we've discussed where we should pay for this with further conversations with what John has relayed to us and with what other people I've talked to. This could be never ending cost to the county. I'd be more comfortable if there was an end date or a date we could reevaluate the policy. I'm not against the county paying for it. I'm just thinking if this is going to be something for who knows how long this could last.
1 to 3 years.
That is the point. I think that possibly to address your concerns could be remedied by saying the cost will be borne by the county, and giving it 6 months at the outside. And hopefully by then you'll hear something, everyone will hear something from the Supreme Court. In the meantime, just even knowing, having people in a testing queue, if you will, and a reporting queue for our office, if there were tests, we still don't know who we have to monitor with regards to the testing. So my recommendation is to, with modifications that you're possibly considering, at least moving forward so we can start understanding the potential, so we can argue good faith compliance, but also understand the numbers we're really dealing with. Are we dealing with a large number of tests? Are we dealing with a small number of tests? Where are we at with regards to that? And from a financial perspective, Commissioner, I think that would be important information to have as well in trying to determine.
But if the Supreme Court would throw this out, then we wouldn't have to gather that data. So we're gathering the data, not knowing what's going to happen here. would it make sense to wait and see
When
what
it
the
comes to
decision
OSHA
is, and then
standards,
we could start collecting the data?
That's your decision. When it comes to OSHA standards, my office has the position of we enforce OSHA standards in the workplace and make good faith efforts to do that. If you are analyzing the risk to the county, I'm not doing that. I can't advise you on that. I don't know where that would end up at the end of the day. And
So is it your office that's going to do the testing and the monitoring of the test?
Monitoring.
no, we have, John has presented some, nobody in the county will be doing the monitoring of the test. John has mentioned Vault Health, but we would be doing, once the tests were collected and the documentation is provided by the employees, we would be monitoring, if you will, the compliance with the testing, but not the testing. Maybe that's what you were asking about, was would our office be monitoring compliance with testing?
Yes.
Yes,
Well, do we want to spend money on testing and then 3:30 comes and go out to Quick Trip and pick it up? Other companies got to be in the same page or this ain't going to work. I'm sorry, but this is a great program, don't get me wrong. But if somebody else ain't going to go along with it, like Quick Trip and Weezer Brothers, you got big companies and they don't give a shit. I'm sorry, but that's the truth. So
I just read last night that administration ordered the private health insurers to be required to cover 8 COVID tests per month for people on private insurance plans. So therein lies where the county wouldn't have to pay for it if their insurances have to pay for it.
I also heard that is something that is being looked at as a mandate to health insurance companies.
Yeah, it's to start on the 15th of January.
And I was wondering why 8, and I suppose that is for 2-spouse households.
Yeah.
And that puts you into your,
Because if it's every 7 days, that's 4 per month.
that's just an assumption on my part, just based on the arithmetic.
well, on the news today, they said they were going to send each family 8 test kits, but they don't have 8 test kits yet. Yeah. So how long that's supposed to last before, I don't have any idea.
There's a lot of things that you're banking about in the news, and it's obviously a very newsworthy. But I think we can legitimately say that tests are not readily available. I think this is primarily an OSHA thing that as an employer, you got to decide what you're going to do to meet compliance. If the Supreme Court comes back and changes this or tosses it out, you may want to approve this contingent on revisiting it based on Supreme Court findings.
But if we approve this today, then the personnel office can start tomorrow acquiring
Proof of
data.
vaccination.
Right.
And I think to be, maybe I'm misstating, but I think to prove good faith effort in executing your policy or response to this as an employer, the date to get started on that was yesterday. And so that rule stands currently. They didn't put a stay on it or anything.
Right.
Not going to change.
Right.
That was the, we're a little bit behind just because the time periods are not behind in the deadlines. The deadline was yesterday. Here we are today. I think just going through and having a first and second reading of the policy, thinking through alternatives for testing and thinking through all that. That was good faith in my opinion anyway, that we are trying to work through this even with all the challenges.
Question I've got is with regard to the Supreme Court looking at this, did they put a stay on the enforcement of this policy? When I read what OSHA said was that it's still a policy that has to be followed until the Supreme Court knocks it down.
That's my understanding as well, Commissioner.
So although the Supreme Court's looking at it, if they haven't put a stay on it, we're still liable for this policy.
Right,
That's my understanding.
my understanding.
I have a couple of questions. Do we need to have this policy enforced in order to start collecting information?
We need to have, we should
Okay.
have the policy in place so that we can request this information. So we have a legitimate business purpose in collecting this private medical information from our employees.
The other question I have, can this be put into a situation of an annual review? As was brought up, it could be going on for a long time, but say that we do the policy now and 12 months from now, we review it and adapt to the changes, because I'm sure, as we've all seen, there's changes daily or weekly. Can we put an annual review on this type of thing?
Yes, any policy you have is not permanent, as far as, that's my opinion anyway, that once you have circumstances change, you should be looking at that. We would put at the bottom of the policy that it would be reviewed upon request by the board, and any changes in the policy would be, our employees would be immediately notified. And that's what you normally do with any kind of policy. So it's not, it's in stone, but it's not in, the
Irrevocable. It's like the old
morphology of that
policies where
stone
you have to keep your horse tied up, and when, we quit riding horses to work, we changed the policy.
And did we get any comment from Sam? I see he was part of the copy. Did he have any comment one way or the other?
No.
So is all companies gonna follow OSHA then now, starting now, or how's this gonna work?
Well, companies that have over 100
120,
employees.
And it doesn't matter if they're working in the workplace or if they're working on their own. If they're an employee of 100 or more, they still got to get, they still have to meet the requirements.
Right.
So we're looking at setting up a policy to show good faith.
Mhm. Collect the
Yeah,
data
part-
and.
Oh, I'm sorry, Commissioner.
Well, I mean, like you say, we just like you are, collect the data, and we'll pretty much know how many unvaccinated people we got. So that'll give us an idea how much the cost is gonna be.
We need to know how much of an impact it's going to be.
Right.
As we discussed in our community service meeting, that we might have 2% or we might have 20%.
But
Until we get that information, we need to go forward, and right now there is actually no cost to the county. Right now, it's just to get things going and to comply and show good faith effort that we are complying before, who knows what kind of things will happen. So I
And
think we
I
need to
think
have
it
info.
would be reasonable for an amendment to this, that the cost of compliance will be revisited. And that can simply go
Because it
by
doesn't
or-
matter how many are unvaccinated. It says right here that we'll reimburse to testing. So it doesn't matter.
Well, it does at the end of the day to the total cost,
Right, but I mean, we're adopting it that we're going to cover the costs. So
unless you amend it saying that you will cover the cost for the first 30 days, for the first 60 days, once we initiate the testing protocol. That's to be determined. The other thing I'd like to mention to the board when analyzing any kind of policy, it is a risk analysis. What is your exposure if you don't comply? What is your exposure if you do try to make good faith compliance? And so I think that's important as well, and especially if the current OSHA mandate. Not, I shouldn't say not compliant, not making good faith efforts to comply.
And looking at this, if there is a cost involved, this is a mitigation of COVID from my way of looking at it. We're trying to reduce the spread of COVID. That's what ARPA talks about, mitigation of COVID. So if there is a cost, the time that you have spent keeping the records, the time that people have to do to go and get the vaccination that the county is responsible for. Seems to me that all would qualify for ARPA dollars from the perspective that it's a means of mitigating COVID.
I think we have to have a time limit on it though, because that could really use up our funds really quickly if we go for years.
Oh, 6 months or a year would be
Yeah.
more than adequate. And then review.
But could we put that in the policy?
Sure.
Could it also be in the policy to simplify this, that this policy will be reviewed every 45 days, every 30 days?
Mhm.
Maybe 30 is too short of a time
It's too short
period,
a time.
but every 60 days. And that you have review every 60 days just built into the policy, because you are
Yep.
correct, we don't,
Or as needed.
Or as needed.
Mhm.
and then it simply becomes a matter that comes in front of the board with the recommended amendments that, for consideration.
So when they, like our employees, but they all get tested on a Monday morning, or do they all go separate times, or do we all just do it and be done?
That can be looked at from my perspective, as easiest, one size fits all, everybody shows up, but that's, I don't think is practical. And would really impact our departments as well, because, and trying to, as you well know, trying to get 5 schedules together for a particular meeting is a challenge. Trying to get 35 schedules together to show up at one time at one place would be, I think, overwhelming.
I urge some caution on that. I think, again, if large healthcare organizations are having a hard time standing up for a response like that, I don't know if we're positioned to do that. If I think good faith also extends to the employee who's making a choice. And so I think we say there are options for you, and it's their responsibility to show that effort. And I think those options are hopefully going to improve over time as supply becomes more available. I'd also urge caution on cost, as Commissioner Johnson's brought up, that it's hard to estimate what those costs will be, but the policy as it's stated right now, you take on those costs, and there's a wide range of what they could be. On per test costs, the cost of having people and their time, all of that, I urge caution on that. I also think it's a good idea to revisit it, in a fairly short fashion, and also or as needed, because we may hear in a day or a month or 6 months what the Supreme Court decides. They typically sit on things and think of through before they issue a ruling.
Can an amendment say that this shall be reviewed every 6 months or as needed, or the other way around, as needed, not to exceed 6 months or 60 days?
Like that
Put
one
put the
better.
number in there.
Yeah,
As needed, not to exceed 60 days. Is that
right.
feasible?
I think we need to review it every 60 days for sure. Or like you say, if the Supreme Court comes out, we can do it as needed
There we go.
next week.
So which should we put first, a date
I think
or
for
as
at
needed?
least- for at least the initial review, because there are so many unknowns that we're, and challenges that we're dealing with. This policy shall be reviewed by the Board of Commissioners as needed, not to exceed 60 days.
Yeah.
Such review not to exceed 60 days.
That gives us an idea that come cost time, or when we know some of the percentages or numbers, then we can start looking, okay, now we need to tweak it one way or the other.
And so, if in fact I agree, Commissioner, if in fact healthcare providers are required to cover asymptomatic testing for 8 tests a month.
You mean not healthcare providers, but insurance.
Insurance, excuse me, pardon me, thank you. Insurance companies,
Not public health.
not public health.
No.
Not healthcare providers or public health, insurance. I apologize for my misstatement. it might be a very simple process that we go through, and not to talk anecdotally about, own experience, but last Wednesday I decided to go in because I had a throat tickle to get a test. I went in, got my test. I went to my portal. The next morning, the results were there, negative. I'll let you know.
But I'd also.
But it was that straightforward. And maybe a lot of it will be that straightforward. We just don't know.
That was a symptomatic test.
That was.
I experienced the same thing. Commissioner Myron in Spring Grove. I drove up, I had symptoms, also got a negative test. But there's a big difference as you think about testing right now between symptomatic testing that is ordered by a physician or healthcare provider and regular asymptomatic testing to meet the mandate of this OSHA ATS.
And asymptomatic testing, it's my understanding, is not covered by our current health insurance.
It is in this new directive, it will be,
What,
that the administration put out for 8 tests a
It
month.
will be if it's adopted.
It's been ordered down from the executive branch to the insurances to do this.
It would be then. We'll see.
And they sent out 800 test kits this morning, and that's not gonna go over 800,000.
Well, I look at
I
this
have
from a
to-
practical standpoint here. If you just think about all the employers in of 100 or more employees, there's going to be a huge surge of demand for tests. So then, as an employee, I worry about our employees here and retaining our employees. They're going to say, well, I can't get a test. If I can't get a test, am I still going to be on medical removal here?
No,
Because
we're talking about good faith compliance with testing. If testing is not available,
You can't.
now avoiding a test is one thing, but trying to get, if they aren't out there, they aren't out there.
I think good faith is something that is
Everybody.
both falls on the employers, the county board in this case, as well as the employees. Have to have good faith. And I agree with you, if there's not a test to be had, I don't think that's a earth-shattering news break. Everywhere you go, everything you hear about it.
Yeah.
As far as.
But there's concern of the employees that are going to say, well, this is a big change here. And if I can't get a test, am I going to be, disciplined?
I
And
think that would be
I think-
unreasonable to discipline. And I have not heard a concern from the unions, except for the question asked, who's covering the cost of the test? So,
let's say you call up,
You're looking at the
this is
supporting.
Bob Burns' son, and
Is that
you
what
ask
he's
him if
talking?
he's been tested, and he tells you it's not.
No, that's for
What
vaccinations.
happens?
well, that's
They get 4 hours.
You
where.
fire him right there, or?
No, I don't believe so, Commissioner. We have processes that we go through with our employees if there are performance issues or failure to follow OSHA requirements we have many OSHA requirements. And we would go through that process with them. Just as we would with any other OSHA compliance requirement.
So what percent of employees are we gonna lose by going to testing? Or to having
Well,
them test?
if other employers are doing the same thing, I don't know that we will be losing employees. If someone chooses to leave over this policy, they may. I wouldn't be making that. But to be honest with you, if other employers are required to have a similar kind of process, I don't know where they would be going, where they wouldn't have to.
They'll go to an
comply with this.
employer that's got 100 or people or less.
They could.
And there's a
And that
lot of
may
people.
happen, but.
And that may happen.
It's, I think the bottom line issue is compliance with an OSHA requirement for you as an employer, and then the policy that supports staff to be able to enforce that so that you show good faith. So in response to your question, Commissioner Marty, I would say, if somebody says I'm not going to comply with that, then follow whatever disciplinary procedures you have for any other county policy. And obviously, I think Tess's office would probably be communication, with the personnel committee, different things as this rolls out. My hope is that that wouldn't come to that. I think, you know, we put a lot of focus on people who would be against this, but there's a pretty loud number, or a good number of loud voices on the other end of the spectrum too, that feel that we haven't done enough. And you see that in communities and in groups of employees, all of that. And so those would be people who would reach out to OSHA and say, hey, we're not making a good faith effort. And that would be something that would potentially get you a visit from OSHA. So there's, you know, part of what we're trying to do is mitigate potential risk to the county either way. And, but, you know, these are all hugely contentious issues, not just in Houston County, not just in employers of 101, it's everybody. And God knows, I mean, everybody's tired. I know I am. Not something that I think, hey, this sounds like a fun thing to dive into. My advice to you guys is just what is necessary to keep you compliant with OSHA and mitigate potential costs for not being compliant.
By adding that amendment that we will review it as needed or within 60 days, protects us right there, good faith.
Another, okay,
Go ahead, Bob.
another question with regard to this good faith aspect of it. So if we've got 20 employees that don't have the vaccination and they can't get the test, are we giving them a good faith reason, you know, benefit of the doubt that although they know they have to be tested, they aren't able to get a test, so that, you know, maybe they're only receiving a test once a month instead of every week?
How can you discipline somebody for doing everything they can to comply?
Right.
Say an organization.
But if you get somebody complaining to OSHA that we're not compliant,
Well, you know,
We have
see the thing that we were creating here, not we, but I wouldn't want to be OSHA trying to enforce this. I mean.
well, my experience with OSHA has been that they work, and we've had OSHA visits here in the county, that's not a secret. And in my former employ, I worked closely with OSHA and OSHA inspectors. And my experience has always been, and what they have told us directly when we have that visit, is they work closely with us to achieve compliance. Their number one goal is workplace safety. It is not, let's see how we can fine and penalize the employer. So they would work with us. I think one of the important factors in here is the masking policy. Because if you don't, we may not physically be able to achieve testing, but masking is something that is achievable and is commonly done by many employers. So, you know, this isn't just a testing policy, it's a testing and face covering policy. So there's that side to it as well. And I think with that, we could show we're really trying very diligently to comply to the best within what any reasonable employer, and that seems to be a standard, a reasonable employer would do with the resources that are available to them for enforcement. And
So does this applies to all employees?
all employees, the discussion I understood or I took away from the last board meeting was that when John and I were here, we were talking about trying to keep people's medical information as private as possible, not physically showing who is vaccinated and who is not by whether they have a mask on or not. And then trying to, and not alienating one group of people or causing more friction between groups of people. That the masking policy is something I understand that's recommended by the CDC as well as NVH. And that it's just, there are a few exceptions to the masking policy, but, and they're clearly laid out in the policy.
So if the Supreme Court would rule in favor of OSHA to put all this stuff in place, is that going to be every business then or just 100 some?
100 plus. Just 100 plus.
Well, why can't we get that included for every business? Otherwise, we're not gonna get. enough.
We can't do
Well, I
that.
mean, yeah, how can you?
Well, we can't,
That's a good argument. That's a good argument.
but we can't do that.
No,
That
I
has
know
to
we
come
can't.
from,
Somebody else has got to make
It's
sure
better.
that we all do it or we might as well forget it.
And you know, there are some smaller businesses that do require their people to mask. I
well,
mean,
and that's a different issue. That's,
That's
that's a private company's choice to do that. But this is an OSHA mandate, so,
Mhm.
and we have to follow through. And I agree with what Dewey brought up about, and Teresa, about the end date and review and all that. My stance right now today is I'd like to table it until we hear from the Supreme Court, but
I just want to add that this didn't actually get in the packet on the website. So if you do adopt it today with any changes, I'm not sure who all for employees has seen it. So you'll just want to make sure you get it out
Mhm.
because it isn't actually on the website yet.
I have sent it to, not all the units, but AFSCME requested a copy of the draft policy
Okay.
and I provided it to AFSCME business manager.
I know it's in conversation amongst the employees.
Okay.
They're talking.
I just,
It's been brought up in discussions and people are hearing about it. And, you know, I think that because of these mandates that come down from above, and we don't want to open the door for them to come in. And I appreciate the comment about OSHA doesn't penalize. They prefer to train or help or work with. But I think we got to show that we're trying. And when we put in the not to exceed 60 days, things might change next week. And then we got that other phrase that says as needed. Sunday night, we get
that's
the,
first, not as needed for 60 days.
yes, that's what we said.
Correct.
Or I should say, and 60 days.
No,
Not to exceed 60 days is what I said in my statement. But anyway, you know, Sunday night might come down and say the Supreme Court said this. Next Tuesday, we talk about it. You know, I think we got to go forward and show the good faith. And those two words make the big difference.
I think so too.
And, you know, as a practical matter, the business climate, the legal environment in which any business, including county governments, city governments, et cetera, operate is the landscape changes on a constant basis, probably more so now than it ever has in the past. In order to be a effective organization, I think we have to have be nimble in how we respond to things, not be not a flavor of the month type response, but we do have to have some flexibility in how we comply with that changing legal environment. And I think what you've proposed today with review as needed, not to exceed 60 days is responsive and responsible.
Question with regard to the masking policy. So everybody has to wear a mask. I waffle on that, you know, the people that have got their shots, we're making them wear a mask whether they've got the shots or not. But from the masking policy, if they're in their own office cubicle, you don't have to have your mask on.
Yes, the
If
policy,
you're driving a truck for the county, you don't have to have your mask. So if you're individually alone, it's
correct,
only when you're around people that you gotta have your mask.
correct, Commissioner, and it needs to cover the nose. It doesn't need to be down like
Right.
this, like I see some folks
Properly
Try to wear.
worn.
properly worn. And
And the proper kind. I mean, you go over to Mayo and bandanas,
They won't allow them
cloth
anymore.
masks,
It has,
It's
I
gotta
think
be-
actually it went to N95 actually.
and they provide you one if.
It's multi-level.
A word on N95s. I'd be concerned if we go too far down that trail because it isn't just give it to them. You have to be properly fitted.
we have
A lot
test
of people
fittings.
Struggle to be properly fitted.
If you have beards and whatnot.
Facial hair, all kinds of things. So when we say N95, be careful.
Well, I'm just saying that's what they went to.
Now, we it may be different for Mayo requiring a patient coming in with symptoms to wear that versus in the employment setting, which is where we come down for OSHA, then we'd have to have training and testing on the proper wear of an N95 mask with fit testing. And we could not take that on with all of our employees.
When I was there yesterday, I went into the cloth mask that I always wear. It's not good enough. They give you one of those paper masks. So it's not an N95 mask. It does not cover as good as my cloth mask. But for whatever reason, that's what they accept. So it doesn't have to be an N95, but it has to be either the one they provide or an N95.
So what this policy states with regards to face coverings is they must completely cover the nose and mouth. This is on bottom of page 4. Be made of 2 or more layers of breathable fabric that is tightly woven, and it's the weave that they are concerned about.
Yeah.
So that fabrics that do not let light pass through when held to a light source. So we get some practical advice there as well. And then how it's to be secured. So
That'll be personnel's responsibility to make sure those are being used.
well, I think it's the supervisor's responsibility in the workplace to make sure that their employees are compliant with county policy and OSHA requirements, just as any other OSHA requirement.
So we're walking in.
And so if they have problems, they call us up and we walk through it.
So I look at your mask. Covers your nose, got big gaps on the sides.
Right here.
Yeah, you know, I mean, and you've got a cloth mask, it covers better on the side.
The issue is, I would think, the projection.
Projection.
You know, we could
This-
spend a lot of time.
Yeah, I'm sorry I brought it up.
Yeah.
The efficacy,
Yeah.
I don't know that, I think what you want is to make sure that what you have in place meets the
The minimum, not the,
minimum. Yeah, and, you know, another word on masks, I think, you know, things that Tess mentioned as far as separating people who are or aren't vaccinated based on whether they wear masks. I'm vaccinated and boosted, but I wear a mask a lot.
myself.
And so I don't know that you would necessarily know that. I think more the challenges in enforcement in how do you chase those people around, and by just saying, you know, follow the CDC guidance for indoor mask use makes it easier on all of your county operations. So we spend as little county effort to be able to achieve that. That's kind of where I'm coming from.
No, and side benefit of masking is if you have someone who has a cold or a cough, you've minimized exposure and workplace absences. So
I noticed that the policy does say that face coverings will be made available to employees by Houston County. So if for some reason an employee is wearing a mask that doesn't meet what's listed above, like the 2 or more layers, they should be given a mask that they could instead wear, correct?
Do we have a supply of those? Do we have a supply of those?
some departments have and some don't. We'd have to obtain
better
them
get some.
further.
They're readily available
I mean-
more so than the N95s, like what the test is.
So
They're easier to get a hold of.
we're not required to do that by OSHA. That was just something that we understood that the board wanted to consider last time, that be put in, that we provide the mask and the cost of testing. Maybe that's something that you should look at in your review of the policy as we move forward. And I know I have cloth mask at home that I can put filters in. I mean, a lot of people have preferred face coverings. So I don't know what that demand would be either.
Well, we got any more discussion on this? Does anybody got any ideas? Do we want to?
I think we should, I think we should approve of the OSHA compliance policy contingent on the 2 amendments of as needed review or 60 days, and And also with the final one being posted and published on our website. So we would actually approve it a contingent on those requirements. That's my feeling right now.
Is that a motion?
Yes.
I'll second it.
Okay, we've had a motion and a second. Did you get the motion down, Allison?
Can you repeat the motion just so I understand what it is?
Want me to?
Yes.
Okay, so the motion is to approve the test and mask policy, adding at the bottom that the policy will be reviewed as needed, not to exceed 60 days.
Such review not to exceed 60 days.
Okay, what's it gonna say for the minutes?
This policy will be reviewed as, shall be reviewed as needed, such review not to exceed 60 days from date of implementation.
Okay, and then you want it posted on the website, the final.
The final.
And I will get that to you, should this pass.
Yeah, do you just want to send it to the help desk and they can put it,
Yes.
I mean, where
On
on
the
the
website.
website?
So
Should it be under like
implementation
HR
does not take place
or
until after
in the
it's
announcement section or what?
on the website.
Pardon me.
Should we,
Implementation will start
Immediately.
effectively today.
And why do we have to talk about the website?
Because it needs to be posted.
It needs to be posted on the website, I guess. I don't know.
So actually the.
well, I was just thinking it would be nice for all the employees to get it as soon as it's passed since it isn't in the packet, but maybe they already have it. I don't know.
Well, I
That was
think
just a
a
suggestion.
to all email would also.
Yeah, I think.
Okay.
Okay, we've got a motion and a second on the floor. Is there any more discussion?
Need to address whether or not the Supreme Court passes this, or do we do that in the review?
I believe that's covered under the as needed.
Mhm.
I think that's my feeling.
Yes.
I'd prefer to table it, but
Make a motion, I suppose. can't
all
I?
motions
Gotta
already
act
been
on the
made and
motion
seconded.
that's
so.
made.
So we vote on this motion or?
Yes.
Allison, you might as well do the roll call.
Okay, District 1,
Yes,
District 2,
No,
District 3,
No,
District 4,
Yes.
District 5.
No.
so it's tabled until
Still, Supreme Court makes a decision, I would
for
think.
the next meeting.
well, it should be 2 weeks from now.
So is that going to be a problem with OSHA compliance? No.
I don't think so.
I don't think so because other counties aren't doing it until they hear from them either.
Yes, I should have made the motion.
Until the next regular meeting.
20, that'd be what, the 24th? The next meeting, the workshop next week, correct?
Well, thank you for your time, Commissioner.
No, thank you.
And for your in-depth discussion on this.
All right, moving on. Board Updates. I guess I had not much. We got an airport meeting coming up. Did anybody set a time, you, Bob?
I haven't seen a time, just a day.
I think anytime after 10 would work good for me on Wednesdays. So I get all of Brian. Is he on there, Brian? Guess I haven't had no meetings, so I don't have much to report on here. You, Teresa?
I had Winlac yesterday. Another meeting this week coming up, which I'll report on next week.
I got lots of things I want to ask about. First off, we've talked multiple times with regard to merchants versus Bank of the West. Not on our agenda for today. But we've had the additional reporting from Bank of the West, so I'll let you and Dewey talk about that, but I think, at some point, we're gonna have to make a decision on what we're gonna do with that.
Well, we already have them. We don't have to change banks.
We don't have to. But from my perspective, I look at what the two presentations were. If we're gonna make $20,000+ by switching banks, why would we not? I know there's an issue as far as simplification on this is what we do now and it's what we're used to, so why would we change? But if it doesn't cost us anything and we're gonna make whatever the interest rates dictate what we're gonna make. The original presentation was 27,000 plus. Interest rates have changed, so I'm backing it off, say to 20,000. Why would we not change to make an additional $20,000? My perspective. But, we got to have a decision. We got, if we're not going to change, that's fine. But
Well, I mean, after we had our last meeting, Donna wanted to talk to the state auditor to see if there was anything we have to do to switch the banks. And that was Donna's recommendation.
okay.
So,
John's on there.
Donna, is that correct?
Yep, commissioners, I have reached out to Dave Kenny from the state auditor's office. But for some odd reason, I get a message he's on vacation, but he was supposed to be back on January 5th. And it appears that all the state employees are working from home again remotely. So I'm having a little hard time touching base with him. But as soon as I find out, he knows what I'm after him about. I'd feel better talking to him about the final reasoning and why, how we're switching, what we're going to have for accounts, just to kind of run that by him to see what I need to do or if I need to do anything special. Otherwise, I pretty much done all my paperwork or reviewing with the Merchants Bank. I'm totally understanding where their spreadsheets are and how they come up with their figures. So it looks good to me. I checked out with with our company that we do our mirror imaging with, and everything looks good as far as that goes. She said there's no issues, no extra charges for switching banks like that. Merchants Bank has also offered to provide the first order of checks and deposits if we switch to their bank. So I've pretty much done all that footwork, but I'm just waiting for the state auditors to get back to me. Otherwise, if you guys have any questions or anything else you have for me to want to check out, I surely can.
I agree with Bob. We've had some discussions. We had both presentations from all the people concerned, and yesterday, Greg and I received a email from Donna explaining what she just talked about. So that was some information you didn't have, Bob. But I guess the only question I have of Carol and Donna was the ease of operation. I believe that's been answered. So maybe this could be on the agenda for the 24th to make our decision then. We can't make the decision today, but I feel that between now and then, Donna will get her response from the state, and Carol and Donna will have a idea of what it'll entail. But I agree with Bob that maybe we should do what we need to do.
Would you put that on the action items and Allison for on the 24th? That's correct.
Do you have any thoughts, Carol?
Carol,
About us, or-
anything you want to say?
No, not right now.
Okay. You're the one that has to use it, not me.
And Donna.
No, yep.
Next thing I want to bring up, in reading the Fillmore County paper, I see where where Greg Davids and Jeremy Miller were in attendance at one of the Fillmore County meetings, and the Fillmore County department heads, all of them, the sheriff, the administrator, they all presented what they thought their needs is and what the state should be doing to benefit them. I mean, they talked about long-term funding. They talked about taxing electric vehicles. They talked about the DOC support, Department of Corrections support, which says, right now it says they pay up to 50%, but they're only paying 30%. They talked about partnering on health and human services and dealing with children and their placement and their mental evaluation costs. additional funding for LRIP programs as far as the local funding on projects. They also talked about simplifying property taxes. And so I think, if we could get those guys to come here and we can get our departments to talk to them as far as what our needs, it might be beneficial. So I just wanted to bring that up.
Are they coming next week? Is that when Greg is coming?
The 24th.
Yeah, the last meeting of the month.
Yeah.
Okay.
He had to reschedule initially.
He had to
it was gonna be
reschedule. He
today.
was gonna come today, but he had to
I
reschedule.
remember you said that. So
Yeah, yeah.
Greg
And
Davis,
Greg Davids, Jeremy Miller couldn't come this month. He's all booked up. And the reason they were able to attend Fillmore County because they treat their first meeting of the year as an annual meeting. So, and it's been scheduled, it's scheduled every year. So those two representatives they have it in their calendar. So
if they're coming, we should get there.
we would like to get on, I've requested that we get on their calendar for next year. And I would like to do something like what you just described of what they do at Fillmore County. And they would be, and then actually Mr. Davids have thought we should get a hold of Matt Hilgart from AMC to come as well as a representative of AMC, and he's really good at the legislative process, so.
yeah, we need to get more funds for public health down here. More help there. We need help in a lot of places, but to get it might be a pull. Anything else, Bob?
Oh, yeah.
Okay.
Houston County sales tax has been brought up before. So I want to know if, and Teresa, you had mentioned this, if there was any issue or any thoughts with regard to putting that 0.5% sales tax on Houston County, knowing that our local businesses don't generate a lot of money, but what you were saying is it's the online sales that generate a substantial amount of tax.
I need to get hold of the Extension Commerce Office and find out if they have a figure that they could give us, how much it would generate with the e-commerce.
E-commerce.
But it can't be separated though. It's e-commerce plus sales tax. You can't just
Oh, no.
do
You
an
have to
e-commerce
No.
sales tax. It has to be for everything.
All the
Yes.
sales in
Yeah.
Houston County plus the e-commerce. So I had a taxpayer call me, a senior citizen with limited income and a tremendously high utility bill, and wanting to know if the county has any support for utility bills. When you read the ARPA information, it does talk about, low income and housing and utilities and whatnot. If that's something we want to look at as far as assisting the senior citizens with utility bills. I don't know if SEMCAC, I gotta check with
does have a
SEMCAC on that too.
program. Yes, I
So-
totally do.
And I think if you would contact the utility company, they also have
Yeah.
access to those, access to programs like SEMCAC or
I know SEMCAC definitely.
through the state for that kind of stuff too.
Mhm.
I read the ARPA summary that Carol gave me the other day. There's 44 pages of summary for the 400 plus pages of overall ARPA. Supposedly,
Final rule.
Hmm?
It's the final rule.
the
now.
final rule.
Okay.
Supposedly, the final rules have been made a little more lenient, less restrictive.
Mhm.
But when you read the 44 pages, there's things that used to be in there that aren't in there now that I gotta go looking at the 400 pages because I want to see what we can do as far as emergency services and whatnot. It does not mention that now in the 44 pages as far as like fire departments and
They
ambulances.
discussed it in the webinar,
Okay,
fire districts.
Yeah.
You can even use it, I think they said for like buying a new fire truck.
You
yeah,
can, yeah.
Oh, really?
Yeah.
Really?
Yeah, Carolyn and I both attended a webinar
Mhm.
yesterday and it was pretty helpful. And I think that's gonna be on their website, or it should already be. So
okay.
maybe we could send that to all of you if you want to watch it.
That'd be helpful.
That'd be good.
Good.
It is, and there's a lot more uses. They expanded the whole clean water, drinking water, to include lead abatement, but then the sewer, what did they have before, like it expanded so that culverts,
Yep.
culvert replacement, sewer, which the drainage in our parking lot,
Yep.
would more be covered.
Send us a weapon.
So if we got that, I'd appreciate it. Had a community services meeting this morning. I'll let Dooley report on that. This is informational. On Saturday at Four Seasons between 10 and noon, there are 5 candidates that are running for the position of governor in the state of Minnesota on the Republican ticket. They're having a debate. If anybody wants to go and listen to what the Republican candidates have to say. And then, anybody heard about Bremer Bank in Houston? And what's happening with them?
Yep, they're going to close the bank as of April 15th is the date. So, yeah, they're closing the doors.
Wow.
So Houston won't have a bank unless it's by courier?
Right. And Bremer is going to try to provide, online services, like they've always done. But it's kind of devastating news for the town of Houston.
Yeah.
It'll be really bad for the businesses who rely on the bank for cash for their business.
Yeah, boy, that's gonna be tough.
Yep. So
Funny, it didn't make a go of it, or?
No.
Who
I
knows?
have a little inside track, but they were profitable, and it was just the lack of foot traffic was what it said in the letter. A letter went out. I think most of the people got their letter yesterday. The letter went out, the lack of foot traffic. And they're always looking at potential growth in the market, and they didn't see any. We can all debate on why, but I'm not going there. So, yeah, it's bad news for the town of Houston. When you lose your local bank, it's not quite as bad, but just like losing a school,
Hoka went through that too.
And Bremer's a foundation, so they never sell a branch off to another bank. It's either they keep it open or they close it, because that's the rules under the foundation. So
But they bought it from someone, didn't they?
they bought it from Eastwood.
Oh.
Yep.
Seems odd.
That they bought it? Well, they can buy banks,
But again,
but they cannot sell banks to another bank, branches to another bank, because they're a foundation. It's not a privately owned corporation, it's a foundation.
But they could sell the building and another.
They
bank?
could sell the building, but that's going to take time, because they have to take all the equipment out, get it ready for sale. And
well, as we're talking here, I'd see
because
others want to come in, because in La Crescent, we got 4, and who says that, I'm just going to throw out Eitzen or Merchants or Home Federal decides to put a branch in one of these, in that building. Me as a businessman would do something like that, but who knows? And hopefully some other entity will say, here's an opportunity to expand, and maybe that's just a thought.
Yep.
That's all I've got. So I'm sorry that took so long.
Commissioners, can I just add something? This is Donna. The only thing that's going to affect like my office for Bremer Bank closing, unfortunately, they've been so gracious all these years to collect taxes, from their taxpayers in Houston. It's probably one of our biggest tax collectors. And so they no longer will be able to, of course, pay their taxes in Houston. They'll have to come up to the bank, or up to the courthouse here, I'm sorry. Yeah. And then we also have one certificate of deposit down there, but we can keep that, it'll just go to either one. We'll deal with Winona or the Onalaska branch. We can keep it. Well, actually, it would be Winona, because that's Minnesota.
that shouldn't be a problem or change anything in that.
No, so as far as that goes, but I know the taxpayers will really, really miss paying their taxes in Houston. So I just want to mention that, and they've been really good to work with over the years. So I'm sure the taxpayers will complain a little bit to you commissioners, but there's nothing you can do about it, so they'll have to just come up to the courthouse or mail their payment in.
I know there's nothing we can do about it. I just wanted to mention that it was happening.
Yep.
Eric?
I had a land use meeting this morning. Martin and Amelia brought up the fact they're still working on the application for an RFP for the land use plan, comprehensive land use plan. And he's trying to shorten it up. And I don't know if he's met with you too, Allison, a little bit.
We're gonna meet Wednesday.
Yeah.
We briefly met, but Martin's working on a new version, and then Amelia and I are gonna review it Wednesday.
Okay.
Simplified.
Hopefully, yeah.
Right, to attract more people.
Bidders.
Yep. And then I had Donna brought up some issues that we've already discussed. Mary was there too, and she talked about they had a few challenges as far as parcel splits and the legalities of a certain split, whether it should be done by a surveyor or by privately owned. It has to be done. It should be done by a surveyor, and it'd be best for both parties to do that. But that's going to be an ongoing conversation. It's something we'll probably have to address in our ordinances in the future. So, and I do believe it's required in our ordinance. We require a survey or parcel split. But I want to review that before. I can't be quoted on that, but
Correct.
Survey is required, it just hasn't been enforced.
well, yeah. But I think, Mary and Donna are aware that it needs to be an issue, addressed, so. I'd like to, in our workshop, I'd like to have a conversation about appointments on some elected offices as far as the recorder and auditor treasurer. It's been talked about for quite a while, and I think we need to, if we're gonna, election year is coming up, if we're gonna consider this, our deadline's fast approaching because you have to have it done by
104 days.
104 days from the filing date. So I would like to have that discussion on our workshop next week on that.
You want to put that on there?
Yep, I'll put that on the agenda.
Okay.
I guess that's all I got.
Do it. Couple of things with the community service meeting this morning. Rob indicated that the new vehicle is not arrived yet. It's ordered and all that, waiting on some stuff. So that was mostly his highlight. In the discussion with John and that looking at leftover ARPA monies, maybe some dedicated rooms. This is waiting until after they've spent all their reimbursements. After reimbursements, we're looking at some areas of furniture and so on. Again, that'll be coming up in the future. The EDMS procedure that they have for accounting with Winona, Wabasha, and Goodhue. I believe we had some memo on that some time back, but he's going to be looking to get that done this year because at the end of 2022, Winona County will not host it anymore for us. So there's going to be some funds needed there. Again, he commented that any reimbursements he wants, this would be after, but he's looking at some of the ARPA monies and so on. And child-friendly room, that's still in the planning. And there's a couple of positions that are being filled that are kind of within the department, no new hires, but just some changing. And the other comment or question I have is I saw an email come down about Board of Appeal training. Who's Board of Appeal and Equalization, I guess.
I'm good through 24.
I think I need to re-up, so.
I'm good.
Are you up
It's
good
easy, you
too?
can do it right.
I think it's my turn to re-up on that, so.
You did, okay.
I just looking at the webinar here to do it.
You
So
do it all online now.
that's what I was reading here. So I just wanted to see the status. Well,
Yeah.
probably work on that this month.
So you gotta all be doing this, or is this
No,
just
we
something-
only
we
need
don't-
one.
We only need one on it.
Minimum of
Right now,
one,
we have
but
two of them.
recommended all.
It'd be good, because sometimes we all can't make the meeting,
Yeah.
so.
All right. That's about it. There's just pretty, but there's a lot of discussion in the public health area, but the highlights are the dedicated rooms that might cost. And that'll be after any reimbursement. You'll come in with a better plan as things go on.
Was a question raised with regard to extension. Is the person out there that's on extent, is that a permanent hire or is that a
Temporary,
temporary
interim.
until a full-time?
Yep.
I didn't
We
know.
actually had a meeting about that last week. And so reviewed the candidates and narrowed it down. So
We'll put on the agenda for discussing the ARPA money. I mean, we gotta get back to discussing some of that.
well, we can discuss that at workshop too.
Yeah, I mean, workshop.
I think it's time we start paying out some money like for soil and water for their clean water projects coming up for the year. So
And then you got the fire departments, and if they're gonna give them some money, they can start getting their stuff put in place. All right, well, we have any public comment?
We do, another point of the final rule is that they changed our reporting deadline from January 31st to April.
Oh.
For our first report, so.
of our intentions of what we're gonna spend it on.
But we can start spending anytime, right? I
Oh,
mean,
yeah.
You already have.
I think we have already, I think.
That's what I thought.
Well, I think the only thing we've done was the Creek one, I believe.
Yeah,
Right.
but what about the steps that will be coming up?
That bill will be coming up. Until we get it. I mean, the 40,000 to Crooked Creek is the only money that we spent thus far out of that money, correct?
We allocated the $28,000 to cover the human services costs that were their COVID vaccine and cost. When they had a gap in their, human
We
services
should
had a
just get a-
gap in their financing
Yeah.
for the COVID, the vaccination clinics and stuff that they did. The state money ended and their federal money didn't start until April 1st. So they had provided, which you've all received, that I think it's close to $29,000 that we did
That's the figure.
say that we were going to use ARPA funds for that.
Right.
And then there was the designation about that piece of equipment for the highway department using lost revenue.
Yes.
There's some question whether that would actually be a wise thing to do. So we might want to revisit that. Just based on the way their accounting is for equipment in the highway fund, it makes it a little trickier.
Change lost revenue calculations.
They changed last,
They did.
right? Actually,
There is no more loss.
any, where we fall in terms of the county, if you can designate up to 10 million as lost revenue without having to do the calculations that you previously did, which means our 3.8 million could all be considered lost revenue.
Interesting.
That was the big
Didn't
news I
That
thought
was
at the
really-
meeting, and they spent some time at the beginning talking about it.
So that means you could spend for anything.
It does open up the flexibility. The thing I
Yeah.
will say though is primarily its intent is for COVID-19, and we
Yeah.
don't all know what is coming down the pike for COVID-19. For example, this OSHA thing that could stay in place.
Mhm.
So my recommendation would be not to spend it all at first, just in case there's another huge COVID-19 expense.
We only had talked about roughly half of the overall
Yeah.
3.6.
We still had half of it. We didn't have any.
No allocation at
No.
all.
But we have until you know,
26.
2026
I know.
to spend that.
Right.
We
So
could use a little lost revenue every year.
Well, I mean,
Keep our.
I feel we'll all try to spend it in the most wise and responsible fashion.
Yeah.
And, keeping the spirit of why we're getting that money.
Right.
Right.
But it's not all COVID, it's
It's-
economic.
And
Hmm.
safety.
You know,
And
like
health.
Allison's brought up, what if we all of a sudden we gotta close these businesses down again? We might have to have some money for them again too, so.
I've already had a lot of conversations earlier this week with businesses. I shouldn't say a lot, but more than in recent times, I've had a conversation with a handful of businesses that did choose to voluntarily close because currently they have businesses that are sick. Thursday, the state is having a call with businesses regarding COVID-19, and I don't know what that news is gonna be. Businesses are scared they're gonna put another rollback or something in place. Probably not the case. They're probably just talking about, who knows, but businesses are getting nervous again. So we might wanna have some money for if this really starts hitting them again.
Sounds like we do have it though.
Well, we got a little pad.
Well, staffing is an issue at some of these places
It
that
is,
they
yeah.
cut their hours
That's another
back, so their income is
Yeah,
not
if
the
they
same.
got 4 employees that got COVID, they can't work, they don't have no help.
They can only work for a half a day and not have the supper time or the breakfast time, whichever their business is. So.
You see a lot of restaurants in La Crosse closing at 3 because they can't get the waiters to help to run the night shift.
They run their lunchtime shift and that's it.
Yep.
And well, LC's was closed for a week. They had too many people sick with COVID. They couldn't operate. They shut it down, Not
And they
sure.
also went on a fishing trip.
Boy.
Well, that's a
Well, I
good,
would
that's a
too.
better reason.
Carol, we should just get a microphone for you to have on your lapel so then you can just.
Usually I can talk loud enough.
Uh,
I can't believe I wasn't today. But
Thank you.
apparently, according to my kids, you can yell really loud.
No, yeah.
Don't give me a reason to
Which I
yell.
responded, you don't
All right.
like yelling.
Anybody else got anything up here you want to be talked about, or can we adjourn?
Move to adjourn.
We have a motion
I'll second it.
and a second to adjourn. Any more discussion? All in favor, signify by saying aye.
Aye.
Opposed? We're done. Thank you, everybody.